Have you ever asked yourself, why do ovulation occur? What happens if ovulation is not occurring in females? And what happens if ovulation is occurring in females? That's a question you should ask yourself. So, a recurring series of events occurring roughly every 28 days. So, ovarian cycle ranges from 22 to 32 days, but the average is 28 days. They go. So, why are we undergoing this menstrual and ovarian cycle? Is because maturation of single gamete and preparation of the environment to sustain it. So the ovarian cycle and menstrual cycle is divided into three phases. So from day 1 to day 5, we have the menstruation. From day 6 to day 14, we have the follicular stroke proliferative phase. And from day 14 to day 28, or from day 15 to 28, we have the luteal stroke secretory phase. Luteal stroke secretory phase. So the two interlocking cycle. So we have the menstrual cycle and we have the ovarian cycle. So let's discuss about the ovarian cycle. So in the ovarian cycle, look at the ovarian cycle. What happens? Follicular development. After the follicle have developed, we now go into ovulation. After ovulation, we now go into the luteal phase. So governs maturation and release of egg. So the ovarian cycle governs maturation and release of egg, from starting from the follicular phase to the ovulation to now to the luteal phase, and this governs maturation and release of egg. So we have the uterine cycle. The uterine cycle starts from menstrual cycle. From the menstrual cycle, we now go into the proliferative state or the proliferative phase. From there, we now go into the secretory phase, and it governs the environment for implementation. So the ovarian cycle is for production, maturation and release of egg, while the the uterine cycle is to prepare the environment for implementation. So this cycle interact and overlap to coordinate a precise biological windows for fertilization. So the chemical spark, the hormonal control. So what control these processes? So we have the origin at puberty. The anterior pituitary hormones begins secreting gonadotropin hormones. So the anterior pituitary begins to secrete gonadotropin hormone. In the absence of this hormone, ovaries remain inactive. So in childhood, these ovaries are inactive to puberty because there's absence of anterior pituitary hormone. So whenever this hormone now develops, it leads to the formation of follicle stimulating hormone and luteinizing hormone. So follicle stimulating hormone stimulates ovarian target cell to increase growth and proliferation. Proliferation means growth. So the ovarian begins to grow, the follicles begins to grow. Follicle stimulating hormone, they are stimulating the follicles, they are stimulating the follicles. That is their function. And increase growth and proliferation. So we have the luteinizing hormone, increase rates of secretion and structural changes. So the luteinizing hormone causes what? Ovulation and increase rates of structural changes, while the follicle stimulating hormone lead to the increase to the growth of follicles. It picks 10 to 15 follicles and only one will survive, or two in some cases, while the rest will undergo asphyxia or the rest will die off. So we have folliculogenesis. Let's start with folliculogenesis. What is folliculogenesis? The process by which follicles are formed, or the process by which follicles are made. So the follicles start from primordial follicles. So what is the difference between primordial follicle and primary follicle? The difference between primordial follicle and primary follicle is that in primordial follicle, we just have follicular cells surrounding the primary oocyte. So this is the primary oocyte, and these follicular cells surrounding the primary oocyte keeps it inactive till during puberty. So the primary the primordial follicle which surrounds the primary oocyte, which are aqueous in shape, and surround this primary oocyte keeps it inactive to during puberty, keeps ovum in a primordial state via oocyte maturation inhibitor factor. So they produce hormone called oocyte maturation inhibiting factor.